Let's take a look at the structure of bone tissue. On naked eye examination or macroscopically, two types of bone tissue can be seen in the cut section of a bone. First is compact bone, second is cancellous or spongy bone. So when we talk about the compact bone, it appears as dense area without cavities, and when we talk about the cancellous or spongy bone, it appears in the form of slender spicules, which are also known as trabeculi, which are separated from each other by numerous interconnecting cavities. These are the interconnecting cavities which separated the trabeculi of the spongy bone. Compact bone appearing as dense areas without cavities. Cancellous or spongy bone, bone substance is in the form of slender spicules and trabeculi separated from each other by numerous interconnecting cavities. Microscopically, the bone tissue can be classified into two main types, primary bone and the secondary bone. Let's take a look at the difference between the primary bone and the secondary bone. It is also called immature bone or woven bone. It is also called mature bone or lamellar bone. Appear during fetal development and during bone repair. Adult skeleton consists of this type of bone tissue. Irregularly arranged collagen type 1 fibers, organized arrangement of collagen fibers. Primary bone becomes replaced by the secondary bone except in a few places. Alveolar sockets of the teeth and where the tendons are inserted into the bones. It is composed of thin layers, plates of bone matrix called lamellae in which osteocytes are present. The neighboring lacunae are connected with each other by narrow canaliculi. Let's first discuss about the structure of osteon or Haversian system. It has a central canal which is also known as the Haversian canal. It contains blood vessels, nerve fibers, and it is surrounded by concentric lamellae which is also known as the Haversian lamellae. These are 5 to 15 in numbers. The outer boundary of each osteon is known as the cement line. Inside these lamellae, many osteocytes are present. Now let's discuss about the structure of the compact bone in detail. This is the periosteum. It is a layer of dense irregular connective tissue. It also contains osteoprogenitor cells. It covers the external surfaces of bones. The lamellae which is present under the periosteum is known as outer circumferential lamellae. This is the osteon. It has a central canal which is surrounded by the Haversian lamellae. The central canal is also known as the Haversian canal. The lamellae which is present between the neighboring osteons is known as interstitial lamellae or intermediate lamellae. The lamellae which is present beneath the endosteum is known as inner circumferential lamellae. Endosteum is a layer of vascular loose connective tissue which lines the medullary cavities, trabecular cavities, and it also contains osteoprogenitor cells. This is the Volkmann canals which connects the neighboring Haversian canals with each other. So what are the identification points of the compact bone? The identification points of the compact bone are presence of osteons, presence of Volkmann canal. This is the Volkmann canal. As I have already explained the detail of Haversian system or osteon, with the help of diagram, now let's take a brief look at the Haversian system topic. Haversian system osteon. Definition: the bulk of compact bone in the adults is composed of cylindrical subunits called Haversian system or osteon. This is the cylindrical subunit of the compact bone. Structure: Haversian canal. Each osteon consists of 5 to 15 lamellae of bone matrix that are concentrically arranged around a longitudinally running central canal called Haversian canal. This is an osteon. This is longitudinally running central canal, which is also called Haversian canal, around which concentrically arranged Haversian lamellae are present. Haversian lamellae, the lamellae constituting the osteons are known as Haversian lamellae. In each osteon, the collagen fibers of a lamella run parallel to each other. Cement line. Each osteon is surrounded by a thin layer of mineralized bone matrix which is deficient in collagen fibers. This layer forms the boundary of each osteon is called cement line.